So you recall that at this time yesterday we were flooded with calls from ambulance services officers about the conditions that they're working under. We spoke to one AMBO who had just knocked off from the night shift, and we said at the end of that very lengthy segment where we heard from about 6 people who are on the front line that we had received a very compelling text from a O call taker at the SA ambulance service, and that we didn't want to rush it and jam it in at the end of yesterday's show, and that we thought that we would save it for today's Breaking at 8 because it goes to the absolute core of the issues that are being discussed around at staffing levels in a part of government which is designed, obviously, to protect people who are at death's door. Now just have a listen to this. I'm a O call taker at SAAS. I'm too nervous to call you because management will know who I am. Our working conditions in our communication centre are just as bad as on the road. We are spectacularly understaffed. We work in a building that's outdated with mould downstairs, and we have no room to expand. As a call taker, we regularly can't answer O calls as we are already all on the phone. When this happens, a buzzer goes off in the background, and you're constantly thinking, I need to answer this call as it could be somebody in cardiac arrest, but you can't as you're already on a call. I sit there and listen to my dispatchers constantly scrambling for crews to send, and when I'm on a call with someone who is really sick and I have to stay on the phone with them, I look at my screen and feel sick to my stomach as there's no crew to send. The family are on the phone saying, where are they? Where are the crew? And I'm just sitting there thinking to myself, we don't have one. We need a new building, but most of all, we need more resources. Enough is enough. Now, since we received that text, I made some calls myself, and we ended up getting our hands on some audio of these calls coming through that better than anything demonstrates the pressures that these staff are currently under.
Priority 2 traumatised Blackwood uncovered, priority 2 collapsed case Belair uncovered, priority 2 chest pain Seacliff uncovered, priority 2 collapsed case Norwood uncovered, priority 2 collapsed case St Mary's uncovered, priority 2 psych case Oaklands Park uncovered, and a priority 2 abdo pain uncovered at Morpeth Vale.
Wow. Imagine doing that for a living. And as we heard yesterday, there was a situation the other day where the only available ambulance down south was in Yankalilla. Like this, I don't know why the government doesn't just say, all right, we're going to clear the diary. We're going to have a day next week where we're just going to bring all these people in and talk to them and say, what do you need? I mean, money's no object at the moment. You know, we can find funds for all sorts of things as a result of COVID. How about we find some money to fix this?
Yeah, this is not a luxury. This is sort of frontline, first world public health. And this is the whole reason it exists, doesn't it?
What's the downside for the government to just sit down with all these people and say, hey, look, there's clearly a problem here. How do we fix it? And it's probably a complicated problem where there's other issues, like part of it would be human behaviour, where sometimes maybe there's people ringing ambulances who don't need to ring ambulances. You know, there's these things about over-presentations of hospitals and all that sort of stuff. But part of it clearly appears to be not enough boots on the ground.
Yeah, it certainly does.
We've got calls about this as well. People are calling in to talk to us, and I think they're O workers.
All right, Aaron, good morning to you, mate.
Good morning, how are you?
Good, thanks, mate. So you work in AAA?
Yes, I'm an ambulance coordinator.
Does this, what we just said, and the audio that we just played, is that sort of an aberration, or is that any given evening working in AAA?
Any given evening, any given day, it's happening in an increasing factor. It's absolutely abhorrent.
How do you deal with the job, mate? Like, what do you do when you knock off from that?
I don't think about it. I just drive. I just go home and I eat dinner, chill out, watch TV, and come to bed. There's nothing else I can do. The workload level has been increasing to record-breaking levels on a night shift in early Feb. If it's okay if I tell a story real quick.
Yeah.
But a night shift in early February, the work was like New Year's Eve, but without the resourcing that went with it. And I was coordinating Metro South in the early hours of that morning, and most of my resources were either at a patient's house, on the way to hospital, or at hospital. And I had roughly 8 uncovered priority 2s for my coordination stint of two and a bit hours. And 8 uncovered for the entire time, nothing I could do.
What does uncovered mean, Aaron?
So I had no resource to go to it.
So it means there's no ambulance to go to someone?
No ambulance there. It was just on my screen waiting for me to assign someone to go to it. And there was one case that I remember, it was a chest pain case in the eastern suburbs that I was unable to dispatch a crew to for over an hour and 15 minutes. It
Wow.
was on my screen and I
Chest
couldn't do
pain.
anything with it for an hour and 15.
Chest pain.
Yes, that chest pain case. And it's gotten worse since. We thought 10 uncovered cases was bad then. This was early February. Just like the first one we heard a crew had no break for their entire night shift was bad. It's getting worse, and it's emotionally and physically fatiguing, and I don't know where we will go from here.
Why is it getting worse, Aaron?
It's hard to pin down. It's just we don't have the resources. We don't, the levels of ramping in hospital aren't helping. We just, I can't pinpoint a single reason as why it's getting worse, but it is.
Yeah, but you're the one that has to deal with it in the end. Aaron, thanks for calling us. We appreciate that. Is incredible insight. Liam has also called in. Morning, Liam.
How are you going?
We're good, thanks, mate.
What can you tell us?
Just
Actually, I think we've got a dodgy line. Sorry,
your phone's
Liam.
letting you down a little bit there, Liam.
We have actually got other people calling, though.
Give us a call back. We'll get to you. Mel's on the line. Morning, Mel.
Hi, how you going?
Good, thanks, Mel.
Yeah, I'm one of the extended care paramedics, and part of our role is out on road. So when we're on road, we're finding the same sort of, hundreds of kilometres in a shift, 12 to 15 hour shifts without a break, or only getting one break in the first few hours. But the other part of our job is sitting up in comms with the dispatchers and the call takers, and we support the call takers on those extended calls, and we sit there and we have the dispatchers say to us, I've got 5 priority 2s on my screen. Which one do you want me to send a crew to? And you're playing roulette.
You must. And the thing I thought about that text message too was that you're making all of these judgment calls at the time without the backup that you need, and then you've still got families ringing you saying, "Where are they? Where are the crew?"
Yeah, and sometimes the families are really abusive, and you don't blame them really because they're really stressed.
Yeah.
They're really distressed, and you've just got. And we call people back when we're not going to meet them in the required time frame and meet the KPI. And there'll be some people we ring back 2 or 3 times. You feel like you should be on the Christmas card list because you've had that sort of constant calling back, and just it feels like we're just waiting for people to fall outside of the box of being, a priority 5, a priority 3, so then we can upgrade to a priority 2 to get someone to them. But then we're juggling that with, we've got a crew who hasn't had a break in their entire shift. We're now putting them at risk by upgrading this job to get someone to them and having them drive, lights and sirens, high-risk driving through traffic, quite often, unfavourable weather or traffic conditions, with no break, and then they have to make critical, life and death decisions when they get there as well, and then they transport them through to hospital and sit on the therapeutic vacuum that is the ramp.
Mel, thank you, Mel. We've got some more calls. I just want everyone listening, just listen to the tone of the voices. These aren't people that say they need 4.5% pay increase.
No.
These are people that are exasperated and desperate in their workplace that are meant to be saving lives, and they're trying their best. Liam, I think we've got you on a better line now, mate.
Hey, how you going?
That's better.
Can you hear me better?
Yeah, it's good, mate.
All right, sorry, guys.
No problem.
Yeah, just adding to what Aaron and Mel have said, there's situations that are happening every day. Just recently, I had a case where a patient's relative found them not responsive, not breathing. So, that's our highest priority. This patient's in cardiac arrest and, is potentially dead. And we had to divert an ambulance from another critically unwell patient to go to this patient. And, subsequently, both patients sadly passed away. But it's just, we shouldn't be put in that position. This, like you said, this is a first world health service. There should be appropriate resources to attend both of these critically unwell patients in a timely manner.
100%.
Yeah, absolutely. Well said, Liam. Dean's got a comment. Morning, Dean.
Morning, fellas. Listen, the government is sitting on some money that they haven't spent yet for the events that they're supposed to replace the Calypso with. Go and use it and save some lives right now.
Yeah. Good point, Dean.
Yeah, absolutely.
Scott from Modbury made the same
It's a
point.
great point.
On the text line. Look, thanks to everyone who's called in, and I would say again, I mean, 2 weeks ago, the story about the ambulance service was threatening staff about speaking out. I mean, the way we're going here at 5AA, we're going to have spoken to every ambo in South Australia by the end of next week.
Well, I think next week the person we need to speak to is the Health Minister.
100%.
The Health Minister's coming on next week,
Yeah.
and we're going to talk about this. I just want to replay something for everyone, because now we've heard it in the context of what dispatchers live through and what they're saying, and we've learnt some of the terminology. Listen back to this bit of audio we played at the start. And every time you hear uncovered, it means no ambulance available to go that person. And then listen to some of the conditions that are being talked about. It's really quick, but have a listen.
Priority 2 trauma case Blackwood uncovered. Priority 2 collapsed case Belair uncovered. Priority 2 chest pain Seacliff uncovered. Priority 2 collapsed case Norwood uncovered. Priority 2 collapsed case St Mary's uncovered. Priority 2 psych case Oaklands Park uncovered. And a Priority 2 abdo pain uncovered at Morpher Vale.
Chest pains, people collapsing in their homes. Priority 2, as Mel's told us, that's high level. That's not, someone's broken a toe. Uncovered.
That's a stressful day at work, isn't it? Right there.
Stressful for anyone who thinks they can pick up the phone and call AAA and get an ambulance too.
Well, 100%. And look, if you've been from the other end, the patient end, if you've got your own stories, folks, we are all ears, because this is a story that should be covered at the human being level, which is the way we're doing it. But yeah, it's just that audio. When I got that yesterday afternoon and pinged it through to you guys, I was actually out having dinner with a mate, and I listened to it outside so I could hear it properly. And then I went back and he said, "What are you looking at?" I said, "Mate, I just listened to the most amazing thing."